manual therapy itself, evidence is not strong in pediatric populations. There is some low to moderate grade evidence for very specific conditions. But for the more, I'll say like systemic or even visceral types of conditions, whether it is like more developmental delays, developmental conditions, if it has to do with colic or things like that, in my opinion, little to no evidence for those.
Knowing what they know and knowing what you just said about, maybe there's not a lot of evidence, but maybe they can have some tools, how can they find like the sort of best chiropractor in their area that is an expert in that area and maybe not giving them misinformation around vaccines?
If you go to a chiropractor, they start talking about a few things. You're like, I feel like this is something that I should be talking to my family physician about. Not quite sure why we're talking about that here. Maybe just be hesitant. Now, I think more than anything, when you go to a chiropractor, especially for pediatrics, just somebody who's willing to sit down for an extended period of time. If they're sitting with you for 5 minutes or less, and the first thing they want to do is, scan your child with some weird thermometer device with a bunch of blinking lights, and it has this nice fancy printout or comes up on the computer screen, you're like, wow. Okay, be hesitant of those things. Again, medicine would be using those things if they were actually true.
Right. We would be first to be using those things, but they're not true. Right.
Exactly. If you start hearing overgeneralizations of things, more so than anything, if it sounds too good to be true, there's a good chance it is.
Hey everyone, welcome back to the PedsDocTalk Podcast. I am Dr. Mona, your favorite pediatrician online, I hope, your mom friend, and the person that helps you guide you through everything child health, development, and parenting. And you are watching this on YouTube. And if you haven't already, please pause and hit that subscribe button, as well as hit that thumbs up sign on the video. This is how we get more people to discover this show, as well as this channel, PedsDocTalk on YouTube. And today joining me is a guest that I've been wanting to chat with for a while. His name is Richard Schoonmaker. He is a doctor of chiropractic medicine turned OMS2. And if you don't know what OMS2 is, it's a osteopathic medical student in his second year. And I really wanted him to come on to talk about chiropractic care, what made him decide to leave that to go into medical school, which is, osteopathic medical school in this situation, and just talk about the benefits of chiropractic care, how it connects with modern medicine, allopathic medicine, osteopathic medicine, and so much more. Thank you so much for joining me today, Richard.
I really appreciate it. It's about time that we're able to finally sit down and get our schedules to finally coincide and we can sit down and finally talk. Yeah, great to be here. Thank you.
About time. And student doctor Richard Schoonmaker is what I should say. But, like for anyone listening here, me and Richard had connected over social media. So he has an account as of today. I think it's called Riches. So RICHS_MS2, right?
I believe so, yes.
It may change as you go through different years, correct?
Yeah.
So as of today, that's the handle. And I connected with him because I saw some of his videos come up on my Explore page, and he was making sense of sort of outlandish chiropractic information online. And I was like, I like this guy because I myself have seen a chiropractor. I think they're very useful in this world, but there's this sort of balance of like, how far are we going where it's now just starting to be some pseudoscience information? And so I connected with him, and this was right when he was about to start medical school. He was so busy, busier than I am as a practicing clinician and mom, and that says a lot, right? So know that your medical students are super busy. And we connected. It wasn't the right time, and now we're able to record this. And I think you agree that it's actually a better time now to record this versus when you started medical school a year ago, right?
Oh, yeah, absolutely. It's like you just said, the amount of, I'll say just what is required of a medical student, especially initially, the shock value of beginning school, even leading up to school, the application process and matriculating, it is a lot to handle. And I think, especially right now, way more appropriate compared to back then. At least my ability, the mental capacity, the emotional capacity to be able to sit here, even definitely much more appropriate.
Yeah. And I remember, for me, first year, and also third year medical school was, I think, the hardest. First year, you're obviously getting into that whole world. You're taking all these exams and even trying to learn differently. And, the exams, sometimes like I had to change what I used to know that, in undergrad, maybe I studied one way. In medical school, I was trying to have to study a different way to retain information. And that took a lot out of you. And then third year, obviously, with rotation. So I think we got each other at a good time. And, one of the reasons I was so excited to have you on is because you were formerly a chiropractor. So
Mhm.
what initially drew you to chiropractic care? And then that second question is, what made you decide that, you know what? I want to actually go to medical school. So in this case, osteopathic medical school.
Mhm. Yeah, I think so. Initially, when I first had the idea of even applying to chiropractic school, I was still in college. I actually was in university for 5 years because the first couple years I wanted to be a lawyer. I had the
Oh,
full path to law school, and then eventually just realized it wasn't for me. But so I switched gears, and over time, I think I had an injury when I was in college, and I was helped by a chiropractor. I went to a chiropractor who helped significantly with, I think it was just a back injury. And it was very straightforward, very what we would call evidence based care. No frills. This is what you need to do. It was, if you walked into this office, it would probably look like a physical therapist's
ah,
office if you didn't know any better. And it kind of just, it convinced me like, wow, this really helped me. And I knew I wanted to help people. I just didn't really know what kind of mode that I wanted to help people in. I just knew it had something to do with healthcare. And over time, it
nice.
just eventually ended up being chiropractic care, chiropractic school that I applied to. And I mean, I enjoyed chiropractic school. I practiced for a few years after I graduated, but the entire time that I had or was in formal practice, I also practiced alongside a family physician. And I think over time, as I started to mature and I started to interact with patients more. And because I was in a family practice, I saw, I mean, just as well as many different conditions coming in, whether or not I could treat them. And I just realized over time that what I was doing as a chiropractor wasn't really how I had envisioned helping people, treating patients. And I started to really appreciate and enjoy what the family physician was able to do. And I wanted to be able to emulate that. I wanted to be able to help patients in that form of care. And I think just one day I realized, the story goes, my partner and I were walking through Barnes and Noble, and I saw the Kaplan textbooks
Yeah.
on the top shelf. And I turned to my partner and I said, "Hey, do you think I would have any chance at being accepted to medical school?" And she kind of stood there for a moment and just said, "Yeah, you can do it." And I
Yeah.
was like, you should not have said that
Yeah.
because
Now it's in your brain. Yeah. Now
exactly.
thoughts flowing.
Yep, exactly. I bought the textbooks and so began studying, and here we are. And I think what I will always emphasize though is that even though I'm not a chiropractor any longer, there were a lot of aspects of chiropractic care that I thankfully could bring in to medical school, and I think have actually helped me a lot.
Oh,
Just
amazing
because I
too.
don't want
Yeah.
to practice chiropractic care doesn't mean that there wasn't anything extremely beneficial for how I experience it. It's just not what I wanted to do for the rest of my life. And I mean, it was a career change and I'm happy I made it, but I don't regret it in any way.
I love that. And, I don't know if many of our listeners know this, but a lot of osteopathic medical students have had jobs before becoming
Mhm.
osteopathic physicians. So I graduated medical school in 2012. Wow. So yeah, 2012 is when I graduated medical school. So I also went to an osteopathic medical school. I think most of my followers know that, but if you don't, I am a DO. I went to AT Still University, which is in Arizona. And a lot of my colleagues had careers before
Mhm.
lawyers, businessmen, businesswomen, like chiropractors as well. And that's not as common in MD schools. So you have allopathic medical schools and then you have osteopathic medical schools. We could do a whole other conversation around the differences between allopathic and osteopathic care, but that's not this conversation. But the point is, I also saw the benefits of my colleagues who were actually older. I remember having a 52-year-old friend in medical school when I was in my 20s who chose this as her second career. And that's also hard, right? Having to learn this level of information when you have older children, your brain is not as sharp as it used to be when you're in your 20s, and maybe you got used to learning a certain way. But you talked about something that I thought was really awesome, and you alluded to it. You saw evidence based chiropractic care as you practiced. And how many years was it again that you were practicing?
I practiced for 3 years.
Okay, amazing. I mean, that's actually a really good amount of time to kind of get, obviously to see what was going on. And did you see a lot of the online non-evidence-based information we see chiropractors sometimes talk about. And the reason I'm bringing that up is that I think there is a negative perception of chiropractors online. And the example I give is that there'll be a doctor share something, and the comment will immediately be, how did I know you were a chiropractor before I even saw your profile? And it's usually a negative dig because that person is spreading misinformation. And I have a hard time with that because, like I mentioned at the intro, I saw a chiropractor during my son's during my son's pregnancy. I had really bad sacral pain, and she helped me so much. I do not dig chiropractors, but what I do not like is the misinformation around vaccines, the misinformation, maybe overstepping boundaries of what their education is, what they were learned in chiropractor school. Did you see that while you were practicing, or did you see that more online, or that sort of misinformation coming out in terms of some chiropractors falling into that other realm of how they, what they talk about and what advice they're giving their patients?
Yeah, I started to see that type of content even when I was in chiropractic school. I think it was just over time, and we see this now, where the age of information, social media, even thinking back when I was in college, Instagram was not really a thing even
Yeah.
then. And
Yeah.
now, I mean, it's everywhere. And so even within the past 10 years or so, social media has enabled a few amount of individuals have very big voices. And especially within chiropractic, there are a few chiropractic influencers
Yeah.
who have very large audiences, and you see them all over the place, and they create all of this very, I'll just say, interesting content that
Yeah.
in many cases is not aligned with evidence-based care or evidence-based medicine or just evidence-based chiropractic more specifically. And it's unfortunate because they do have the largest audiences. And I saw
Yeah.
it all the time when I was a student, when I was practicing. And it is unfortunate because a lot of people who seek out chiropractic care have already seen or had some type of interaction with whether it's another chiropractor, it's someone they know who went to a chiropractor, or now seeing it on social media. The amount of patients that I had seen as a chiropractor say, "Oh, have you seen that? Those videos of them like wrapping that thing around the person's neck and pulling it. I think they call it the Y strap." And I'd say, "I've seen it. We will not be doing that here.
Mm.
Here's why," et cetera, et cetera. Yeah. So I did see a lot of that content when I was practicing chiropractic. It was unfortunate. It was a bit disheartening because I think what doesn't always get, at least what isn't always perceived by those watching it, is it sounds really cool, it looks really cool, and maybe there's a perceived benefit, but you don't always notice the harm that those videos can create, what misinformation can do, because it convinces people of something that is not factual, rather than discussing the nuance of many things that are, all things health, the human body, etc. And those were always the conversations that I would end up having to have with patients, trying to have, an empathetic conversation while listening to them, acknowledging what they're perceiving, what they're thinking based upon this social media content, but also trying to get them to understand, this is what you saw, but this is kind of really probably what's happening or what's going on. Or the worst statement is, "I don't know," and
Right.
nobody loves hearing that. But it was always very interesting seeing that content when I was practicing as a chiropractor, and trying not to align myself with those narratives we all too commonly see, unfortunately.
And I know we can't get in those people's heads. I know I wish we would like to get in the people's heads of those that are creating that content, but seeing what you see, and I can also speak to it from a pediatrician lens on pediatricians that may do similar things online. Any reason why they may say the things that they do? Like, do we think that they believe it? Do we think that it gets the clicks, and then maybe that's how they know they can get people following? Because I can't believe that I would never say anything that is harmful that could potentially, because that's obviously someone's health and life. Obviously you could say something outlandish with parenting because you're not going to hurt a child, but with like physical manipulation or, a treatment, like there's lives on the line there. I just always wonder, like, where is the intent there? And maybe you may not know that answer, but do you have any insight as to why we may be doing that?
I mean, with all things, there's probably multiple things
Yeah.
that kind of factor into it. It's the whole, like, people don't know what they don't know.
Yeah.
I mean, we're all human, regardless of how educated one is. It doesn't really matter what letters come after your name. We're all human, and we all fall for the same mistakes, the same logical fallacies. It's easy to fall for those because, I mean, that's why they're so prominent especially throughout social media. But it's probably there are deep-seated beliefs in a lot of these narratives that you'll hear, whether or not it is due to malicious intent, or again, going back to you don't know what you don't know. It's really easy to make broad sweeping generalizations of very complex and nuanced topics. For example, we hear all the time vaccines. Even as a second year medical student, you as a physician, I mean, I definitely don't know all there is to know about vaccines. I know vaccines save lives. I know that for a fact, but I couldn't sit here and give you a lecture on vaccines. There's way too much about it. There's the biology behind it, the physiological effect on the human body, but then there's epidemiological, ethical components to it. Trying to explain all of those different factors and then apply that to a social media post is very difficult. So whether or not it is just not knowing what you don't know, if it is because of malicious intent, if it is because it gets clicks, it's probably a combination of all these things in different values per person. Because some chiropractors who have some interesting beliefs, but really do care about patients. They care about their patients more than anything, but they fall for some of these narratives that just unfortunately are not likely to be based in scientific, and well, I'll say I hesitate to say truth, but scientific fact, scientific truth, scientific research, for example.
I have a hard time believing that a chiropractor is able to give balanced education about vaccines. And I don't know if you agree with that statement, and I can go on as to that, but from that statement alone, do you agree or disagree?
I would agree.
Okay. And that is what I have a hard time with, right? Like, obviously they are specialists in physical manipulation, and we'll go over how that differs from, OMM, which I think it's really important that people learn about what we learn about in osteopathic medical school. But that is what I have a hard time consuming online when it's and it is the joke that I told you someone said that, oh, this must be a chiropractor, because it tends to be the chiropractor giving false misinformation, disinformation, whatever you want to call it, around something maybe related to child development or vaccines. And I'm like, no, no, no. And the reason I say that, and I'm just curious about what education level. I went into pediatrics. It's its own specialty. To know about child development, to know about vaccines, I learned a lot of that in residency, right? In residency, not medical school, is where I learned about vaccines, child nutrition, all of that, because that is residency.
Mm-hmm.
What level of education do you get in chiropractor school? Or is it that, just say you want to work with children and infants, is it that you go to chiropractor school and then specialize? Or how does that work for people who are treating infants and children as a chiropractor?
Yeah. So what I definitely want to make sure I establish first, at least my perspective of the chiropractic education, is strictly within the United States. Interestingly enough, depending on where you are in the world, the length and the content within the chiropractic curriculum can change drastically. I know students in Canada, for example, I think some schools, the curriculum is 4 years, whereas in the United States, I'm pretty confident the standard is about 3 years and 3 months. I don't know where the extra 3 months comes from, but that's just like what I had to do. Yeah. Exactly. And so the way my education was structured, the first 2 years were kind of didactic. Like you're in the lecture hall, you have your physical exam labs, you have, thankfully, I still had a cadaver lab at the time. Patient exams, I think I said that already, but manipulation techniques, all of that. After that, the third year is when you kind of begin your outpatient, I'll say rotations. You're in the outpatient clinic. So my school had a clinic. You went there as a student. You were supervised by another chiropractor, practicing chiropractor, and you saw actual patients. Your first semester was with students only of the school that came for chiropractic care, where there's like younger students coming in. And then after that first semester, you would see all outpatients from the surrounding communities. And that was a really good opportunity because it was the clinic was there to support underserved communities, people who couldn't afford going to see a physical therapist, going to pay for another chiropractor, because they accepted all types of insurance. They helped out the VA. I'm pretty confident, things along those lines. Local universities, even, like there were a couple schools that could come in and receive care also. So that was really great. But in terms of what the education actually contained, it was primarily surrounded, it should be the chiropractic scope of practice, which is depending on the state that you ask, it varies. But in general, they'll say something along the lines of neuromusculoskeletal complaints. conservative management of neuromusculoskeletal complaints, low back pain, neck pain,
Yeah.
radiculopathies from, say, like a disc herniation, osteopathic change. Don't really need to get into the nitty gritty of all that, but those kinds of conditions, nothing very severe, nothing invasive, no medications, no surgeries, nothing along those lines. When it came to pediatric care, my education was very limited. I can tell you when I was still in school, I think I may have had 2-3 max courses on pediatrics. The detail of those courses, based upon my memory, so there's probably some bias in there, but I do not recall it being all that detailed. Not nearly as detailed as the embryology courses that I've already had in medical school, the childhood development courses that we've had, childhood exams, and that, as you know, this has just been my first year. I can't even imagine what's going to happen during year 2 and then beyond. For example, you had mentioned residency. That's where the real training begins. You don't get any of that as a chiropractor. You do get, like I said, you're in an outpatient clinic. Typically, schools will part of the end portion of the curriculum is you go out for your last couple months, your last semester to an actual practice, an established practice, and work in that practice as kind of an intern. Whether or not that practice sees pediatrics, anything along those lines. The problem is none, and this is really where the problem lies, is that none of it's standardized.
Right.
You're not getting any standardized education in how to care for pediatric populations as a chiropractor. There are other third-party organizations. There are, for example, in chiropractic, you have diplomates. So for example, I actually have the chiropractic neurology diplomate. I got that a while ago because some of the patient populations I would work in was like stroke rehab, but not like manipulation, like actual vestibular rehabilitation for stroke patients. But you can do a pediatric diplomate. I don't really know what that entails all that much. I've seen the curriculum before, but again, none of it's standardized by any overseeing organization that checks for consistency and evidence-based care. And that's where a lot of my concern happens, because that's also where you get a lot of different personalities, ideas, and beliefs that can start influencing these things, and it can create more problems in some situations.
Well, that was exactly what I was going to ask, is that sounds like my concern as well, right? We talked about how residency training is 3 years for pediatrics, right? I mean, it is intense training, as most of us would know when we go to residency. It is not easy. I mean, I'm getting a
Yeah.
little bit of a flashback of how, but the fact that it was so difficult is why I learned so much. You know, I kind of joke that it's like a hazing. You know, you go through like a hazing, like a fraternity initiation, and you learn so much. You get so invested in the field because you're like, wow, I just did all that in 3 years. But that is where we learn all of this stuff. And so when there's no subspecialty training, it sounds like you can get that diplomate, but then also you need the hands-on experience, right? So maybe you get the diplomate and you have 3 years of, you know, practicing in pediatric chiropractor care, but then we see online a lot of those bigger accounts saying, using these sort of tools to screen for ADHD or screen for autism, or, you know, don't take this vaccine. And I'm like, what is that? Like, that's not any, if we had that in pediatrics, we would be using that, but it's not evidence-based. So, you know, that is my concern. And you said that perfectly, that in the infant world, it sounds as if there is not some standard of overseeing body like the AAP, right? The AAP, people know that we all take recommendations from the AAP. It doesn't mean we're all sheep and say, oh, AAP, you are the best and everything you say is gold. But I always listen to what the AAP says, and then I take it with clinical experience and I say, that makes sense. Or I think we're missing a little bit of nuance. But there's no body that does that in pediatric chiropractic care. And that's concerning, because then you said it, then you're left feeling like, as a consumer, like as a parent, like trusting that person without any evidence always to back it up, and saying like, yep, I've done this, but wait, what does that mean? You know?
Exactly. And because, for example, for a child or a parent to bring their child to a chiropractor, that chiropractor does not have to have the pediatric diplomate either. They could just be a chiropractor that graduated from chiropractic school, had a standard outpatient clinic experience, had a standard chiropractic practice for their kind of intern rotation, and that's it. They have no prior experience with the pediatric population. They're not or they don't have a good knowledge foundation of those various nuances of childhood development, et cetera, et cetera. And I'm not saying that inherently creates danger, but it's one of those situations where if they don't know about the population, how can they really effectively treat it, and how can they effectively provide advice? Because that's the other thing too. I don't want to get too caught up in is making people feel like afraid of their child going to a chiropractor, because even though a lot of the treatments that chiropractors do, I don't really find are appropriate for the pediatric population. The one thing that is really or can be beneficial, at least when I was still in practice as a chiropractor, is helping especially new parents. I'm not a parent myself, so take this with a grain of salt. But helping new parents when they come in and they have all of these fears, oh my goodness, our new baby is like having difficulty with nursing, or they're not going to the bathroom, or they have colic, they're fussy all the time, we can't get our baby to calm down. So for one, what I could do in the practice I was at, I could triage to the family physician and help them gain access quickly to another doctor. I could help them with advice, for example, like calming the nerves of the new parents. Like, okay, I hear you. I understand what your concerns are. What I do want you to know, a lot of these things, what I never wanted to say to a new parent, or really any patient, even these days, is that's normal. Nobody likes to hear that's normal. What I would say is something along the lines like, this is expected. Like, considering that your newborn is 2 weeks old, I would expect them to, their circadian rhythm is not set yet. They're probably not going to be sleeping consistently every, the same period of time throughout the night or during the day. It may be back and forth as that. You kind of get the picture. Being able to provide just a comforting voice for new parents and help them find the type of doctor that is appropriate for the situation they're in. I would never, at least as long as I can think back, I never performed anything like manipulation, HVLA, high velocity, low amplitude manipulation. For the audience, that's the cracking that you see on social media or YouTube. I would never perform that on a newborn or a baby. For children, I will admit I have done it on children before. Looking back on that, I would never do it just because there's no evidence to really support it. There's some evidence for different types of manual therapy, but that's more getting into like the physical therapy realm. And I'm not very well read on that. But that's just a treatment that I wouldn't recommend because there's no point in doing that to especially an infant or a baby. But at least the role of a chiropractor in pediatric care can be a supportive role, especially for the parents and gaining access to other aspects of care too. It's not all bad. It's just more being or having a logical, clinical thinking process as to how you would treat a pediatric patient as a chiropractor, not just going straight towards something like manipulation.
Well, I love that team approach. Obviously you having worked closely with the family medicine doctor and saying, hey, here's my limitations. Here's where I would refer you to this person. It's like, as a general pediatrician, when I'm seeing someone and I refer to my specialists, right? Or developmental specialists, right? Hey, I think you need a speech therapist, or I think you need a feeding therapist. That's exactly what we would hope would go on here, is that we all understand our limitations and not overstep our educational experience. And also, oh yeah, let me try that. I just, for me, like, even when I do procedures in my office or in residency, I would never ever have the audacity to do a procedure, let alone HVLA, which I would agree as an OMM student as well in my day, to do that on an infant or child. But cracking necks is not something I recommend on a lot of people, by the way, just because of what, risk of artery issues, all that. But that's a whole other conversation. But it is knowing my limitations and saying, hey, do I feel confident doing this procedure? And if I don't, who am I going to send you to? Now, I know you did not obviously have the diplomate in pediatrics, but what other reasons were parents coming to chiropractors as, for their babies or children, or maybe for your colleagues? Like, what other conditions do you find that you saw a lot of parents approaching chiropractic care for?
The number one thing was definitely either the perceived presence or the actual presence of ear infections.
Interesting.
Yeah. And so that was always kind of an interesting conversation because, you will know eons more than I will about, especially like otitis media. But at the time, what I understood was that in terms of the percentage of middle ear infections, it could be viral, it could be bacterial. A lot of parents were always afraid, well, I don't want my child to go on antibiotics. I don't want my child to have ear tubes. And I would kind of have the conversation, well, Well, listen, I totally understand those fears. The last thing anybody wants is polypharmacy. We don't want children to just be on recurrent antibiotics because there's a whole host of reasons why that's not good. I understand your fear of, at least the parent, of having tubes placed because it's a minor surgical procedure, but a surgical procedure nonetheless. However, what I don't want you to be fearful of is that if you go to a physician, is that that's just going to be the only thing they turn to. I know many physicians that are like, okay, well, even with ear infection, exactly.
Yeah, myself included. Yeah.
Exactly. Because it's, even in my limited experience trying to diagnose an ear infection, physicians are going based upon all the evidence they have to decide whether or not, is this viral, is this bacterial. The unfortunate reality is sometimes you'll be wrong, but that's just how that's how practice works. You're practicing for a reason. But what I didn't want parents to be so fearful of is that that's the only options are medications or surgery. If you go to a physician as a chiropractor, they would want something alternative to that. Is it possible, because I heard on social media, or my best friend took their baby to a chiropractor and they were able to help their ear infection because they did something with their neck, and et cetera, et cetera, et cetera. And whether or not that's true, I'm not really at liberty to say whether or not it actually happened. But in terms of helping that parent understand maybe what an ear infection is, giving them some things that maybe they can do at home just to like calm the infant down, that's kind of what they were looking for. They were looking for a solution to help their child. It could have been anything. Ear infections, I think I'd mentioned before, colic, just fussy babies, or again, just advice on something that many times was outside the scope of chiropractic. So I would have to just triage them to the family physician. I had some patients come in, they were asking about vaccines. I didn't know anything about vaccines. I can't help you with that. It's outside my scope. I'm sorry. Anything along those lines. And it was always interesting because many times, like I had said, it would actually be outside the scope of chiropractic. So I could only offer what I really knew, but I couldn't tell them what they should do because I didn't know, honestly. It was always very, very interesting, those types of conversations.
I had no idea about the ear infection one because I have a lot of families who like to go see chiropractors because, like I said, I'm very pro chiropractor care, right? Like if it's a good chiropractor, I'm fine with it. And the biggest ones that I've heard is colic, fussiness, like you mentioned, bedwetting. I hear a lot of people going to, and we can talk, bedwetting, and then obviously on social. Those are the three big ones: colic, fussiness, bedwetting. I didn't know about the ear infection, but that kind of is making sense of like, maybe they could do something to drain the eustachian tube, and we can chat about that in just a bit. And then the other big ones that I saw on social were the things that really rolled my eyes, which was the ADHD, autism treatments, which I'm like, I'm one, having gone through osteopathic medical school, I get that there is a connection between body, mind, muscles. This is what we learned, right? But to say that we can manipulate the ADHD or autism out of somebody, I'm like, no. So my question to you is, based on like the evidence you saw in training, but also, practicing, is there anything that in the pediatric world that does have good efficacy studies, or good, like, hey, we can actually help do this for ear infections, or this, we can do this? Or is it a lot of it gestalt and a lot of it just experience? Like, that's kind of, I guess, my question for a lot of the listeners that they may have as well.
The unfortunate answer is, at least the last time that I had checked the literature, there wasn't much evidence, especially for the most common chiropractic treatment being what they call adjustments, what medicine would call what I had mentioned before, HVLA, high velocity, low amplitude, the cracking, for pediatric populations. For adult populations, HVLA can be useful for things like low back pain, neck pain, things along those lines. There is evidence for it there, but for children, not really so much. I can't remember the exact paper, but I do remember, this was probably 2 years ago now, reading about manual therapy for things like torticollis, for example.
Yes.
That's
which,
pretty
by the
big.
way, we can physical therapists are phenomenal at too. And not
Exactly.
saying, right.
Exactly. So, and that's kind of where I start to, when I read that paper, I was like, okay, well, this is physical therapy.
Right.
It's when it should always be, what I don't want people to misunderstand. A lot of times when people say, because I'm kind of simplifying the process, when I say chiropractic care, the first thing people think of is the cracking. Chiropractic care is thankfully broader than just that. It does include anything from lifestyle advice, exercise, rehabilitation. There is some nutritional component if your state allows you to. It's not just the manual therapy. It's just manual therapy makes up a large part. But in terms of the manual therapy component of chiropractic care, there's not much evidence to support its use for many of the conditions that you had just mentioned that you will see on social media. Things like ADHD. That one always, it grinds my gears a little bit because
my God.
that grinds my gears. The autism spectrum, that one, that like hurts my soul when I read that one, because that is just such a gross misunderstanding, one, of how the human body works, how manual therapy works, but more so than anything, what something like autism spectrum disorder is. And I could talk about this all day. Like it's a very personal thing to me. But trying to, or saying that something like a manual adjustment can somehow correct something like autism, as though it's something to correct in the first place, that hurts me. And it really upsets me to hear those types of things. And maybe that's part of why I have the social media presence that I have, to correct that misinformation, because it is so harmful and so hurtful, in my opinion. But that's besides the point. Going back to the original question, manual therapy itself, evidence is not strong in pediatric populations. There is some low to moderate grade evidence for very specific conditions. But for the more, I'll say, like systemic or even visceral types of conditions, whether it is like, well, nursing isn't what I would call systemic, but you kind of get the point. The more developmental delays, developmental conditions, if it has to do with colic or things like that, in my opinion, little to no evidence for those.
And I think this is a good segue to talk about what you've learned in your first year at an osteopathic medical school. And you already talked about terminology of like what people assume to be chiropractic care, which is the cracking, right? Now I'm curious because I also went through osteopathic medical school and I learned OMM, which for anyone who's not familiar is called osteopathic manipulative medicine. And we also learned HVLA, which is what student Dr. Schoonmaker was talking about, but that's where you crack parts. But we also learned things like effleurage, things like kneading, stretching. So I described OMM as being like the middle ground of physical therapy and chiropractic care. And I'm curious, having been a chiropractor, how would you describe what OMM is to someone who's a chiropractor or maybe just someone who's not a medical professional?
Yes. So OMM is kind of an umbrella term for many different manual therapies. And I probably should have kind of defined what manual therapy is at the beginning. But manual therapy, for anybody listening or watching, think of it as some type of therapy that's generally applied with the hands of the practitioner to affect something on the patient, whether it is a type of stretching, if it is trying to get a joint to crack, anything like that. OMM, osteopathic manipulative medicine, is many different techniques, all with some of similar theories across the board, different types of application for different types of purposes. Chiropractic care itself, the most common form of manual therapy under chiropractic care is what they call the adjustment, what medicine calls HVLA, high velocity, low amplitude manipulation. Chiropractors call it the adjustment. Is when you apply a very quick but kind of low amplitude. So it's not like a large motion, but over a small distance, a force to potentially cause a joint to what is called cavitate. It's just gas bubbles coming out of the joint itself. It's nothing breaking or snapping or anything along those lines. But OMM, you can think of HVLA as being one very small part of OMM. It is an option, and this is actually what I really did appreciate from the OMM faculty at my school. Day one, even, the course director said, listen, everybody, this is the OMM course. You are medical students. I need you to understand something. When a patient comes in and they have some type of non-somatic symptom, so for everybody listening, also think like a runny nose, they have a tummy ache, something along those lines. If a patient has a non-somatic symptom and you apply a manual therapy to them and suddenly that non-somatic symptom gets better, you cannot just automatically attribute their improvement of the non-somatic symptom due to the manual therapy. The reason that is because the human body has a very strange way of, one, experiencing signs and symptoms, expressing those signs and symptoms. But for all sorts of different reasons, those can improve they can get better, they can get worse, or they can stay the same. But just because you apply a treatment and suddenly some random symptom improves doesn't mean that the treatment that you applied is directly responsible for that change. And I really appreciated them saying that, because I've seen that in person. I've applied HVLA, the adjustment, to somebody's upper cervical spine, and they'll say, "Oh my goodness, my sinuses are draining right now. Like, I'm suddenly not congested." And it's possible there was a component that was due to the treatment I applied. Was it the only reason? I cannot definitively say that. But on top of that, later on towards the end of this past year, in block 4 was when my class learned HVLA, so the cracking. And it was interesting being a chiropractor.
Did they all turn to you? Yeah.
Yes,
Did they?
yes.
Yeah. I was curious. Did they all like, "Hey,
many students did.
Richard."
Yes. Yes. It was no secret by the time we got there that I had been a chiropractor, and even a lot of my professors knew. And it was nice because they would ask me my experiences.
That's awesome.
Exactly, just to see like what the difference was, what my opinion was of certain things, and that was really refreshing. Because for anybody listening, all of the physicians that I have been taught by thus far have all had a very positive outlook on chiropractic. Sure, like we've already discussed, they don't like the misinformation, but in general, they've all been very respectful, which I really appreciated, for one.
That's awesome.
But even on the first day of learning HVLA in medical school now, in the OMM lab, the professor said, "Hey, listen, a lot of students are a little hesitant to do this at first. That's okay. It's understandable. But understand, HVLA is just an option. You don't have to be set on just doing this. There are certain people and certain conditions that this may work better for. But there are many other treatment options that you have that probably do the same thing. Yeah. And if you'd rather use that other thing, use that other thing. The reason we use HVLA is if it is appropriate and done in a safe manner. But if either of those, and if you have consent from the patient, but if you're missing any of those three components, if it's not appropriate for whatever the patient is concerned of or complaining of, if you don't have consent, if it's not safe, you're not doing it. But we can obviously apply that to any treatment. But it's, I think more than anything in chiropractic school, HVLA was unfortunately kind of put on a pedestal to be seen in this like magnanimous treatment that can correct and treat all of these different conditions that you don't really even learn about. Whereas in OMM, in medical school now, it was just kind of said, this is a treatment option you have, use it or don't. Not really a big deal. And like, you can see how different that is. It's like in chiropractic school, it's like, right. Exactly. Yeah. And DO school, it was like, yeah, if you want to use it, if not, like you got to get tested on it. But like after that, it's kind of up to you and the patient to choose whether or not you use it.
Well, here's why I like to build up DO school and osteopathic doctors, is that literally that example of what that teacher told you on that first day of OMM lab is why I love osteopathic medicine, and that we are talking about tools in the holistic human experience, right? So it's not always going to be the answer. And you also mentioned that, that if you do HVLA and all of a sudden sinuses are draining, could it be that they felt relaxed at that moment? Could it feel that they, maybe they felt secure, and maybe the timing? Like, I've done acupuncture, I've done chiropractic care, I've done it all, and I'm a medical professional, and I still continue to get acupuncture. And I always say, I'm like, man, this really helped. Is it the acupuncture, or is it the fact that for an hour I was laying still on a bed with no cell phone, no children yelling at me, and that relaxation relax my sinuses on combination with the acupuncture? And so I love that we're talking about that, because that is, to me, the true holistic doctor, right? And I say this all the time, that I do believe that as you go through your training, you're going to really feel that sort of holistic feel of like, hey, we are looking at a disease process, not as like, how am I going to treat it with pharma, but I want to know if I have tools in my tool belt to maybe do some people watching, maybe do some sinus pressure to release the sinuses, or some effleurage here, or maybe I do some kneading and stretching of the torticollis versus, saying that, oh, it's nothing, it's going to get better. Because like you said earlier, it is something, right? It's not nothing to these families and to the patient. And I love that you brought that up, and that we could, tie that in, because it is about knowing the scope of practice we have. It is about knowing when we have limitations. And it really bothers me when I see anyone, not just chiropractors, but even within pediatrics, people who just think they know everything and put things on a pedestal. And like you said, putting HVLA on a pedestal when not everyone can be a candidate, nor does everyone want that. Maybe they want something low intervention. Maybe they just want to have that comfort conversation with you because they trust you. And that, I think, is what this is all about, you know?
Yeah, it makes me think back to, I used to get a lot of criticism on social media because I would get called out by other chiropractors because a lot of my content was calling out chiropractors. And I would answer like, listen, I totally understand where you're coming from. I do call out a lot of chiropractors because, one, I was a chiropractor and I know about chiropractic care. But in the same breath, it's like I also would call out other types of providers too. I remember, I can think of the video right off the top of my head. It was a neurosurgeon who's talking about trying to educate people. You need to have the most upright posture. Your feet need to be directly underneath you, toes pointed straight, yada, yada, yada. And to make sure you don't have like low back pain, you don't need to have back surgery. And I was like, what are you talking about? That's not how this works. I said it professionally, but it was kind of one of those like, whoa, you can't say this to the general population. They don't know any better, and you're just going to scare them. So the whole nocebo effect, instead of having a positive influence, you end up having the reverse when you say or do something. But it's because, like, no matter what, the goal is to treat the patient in the most effective in terms of their symptoms improving, but also cost effective manner, the most effective way possible. And we want you to, by doing so, that can be all sorts of things. It can be using pharmaceuticals. It can be through surgery, but it can also just be through therapeutic touch. Just how sitting down with somebody. I mean, for example, talk therapy, no manual therapy whatsoever, no actual invasive intervention, but talk therapy, and how beneficial it is to just talk to somebody about their problems and listen to them for the first time and have them be able to voice what they're feeling is immensely beneficial and therapeutic for them. Just as much as if you have somebody who has chronic neck pain and they're tired of taking ibuprofen and tired of taking Tylenol and tired of getting Botox injections. One, talk about them or talk to them about their problems. And what if a manual therapy, just doing what a lot of people have heard of, trigger point therapy or acupuncture, these relatively non-invasive treatments that have few side effects outside of soreness. Why can't we do that? Why shouldn't we, when there is evidence to support it? Sure, it's not the end all be all, but if these people have already exhausted all other options, I mean, this is like another segue into why some people may choose to go to a chiropractor versus see their family physician. What if they have exhausted all these other options and they go to their chiropractor? Their chiropractor sits there and listens to them and gives them a manual therapy and maybe a stretch or two that they can use at home, so they don't have to rely on taking an over-the-counter or a prescription. They can do something at home that makes their problem go away just like that. Why wouldn't we allow those people to do that? I think that's, in my opinion, that is evidence-based care to me. And that's a big reason why people choose to do those things too.
Yeah. And it goes down to listening. And, obviously people are going to go to the clinician that is most available face to face, being able to be there with them. And you said, I think you've heard me say this before on my social and podcast, but like, I'm worried that modern medicine pushes people away, given the fact that the system itself is designed to not allow as much time as we could have with patients and parents and, all of that. So where are they left to go, right? They're going to be pushed into the hands of other clinicians. And if we're not careful, it's going to push them into misinformation. And so if we can do a better job of that, as DOs, right? Because we have that holistic knowledge, but time is always the negative on our side, right? Visit times by corporate medicine or by insurance companies, but we owe this to our patients. And so, my final question, for you, having gone through chiropractor school and practicing and now being in osteopathic medical school, how do you envision sort of this balance? Like, what is your kind of dream world where chiropractors and doctors can live in a symbiotic relationship? Like, what would you wish for the world and community?
I think first, everybody has to, the harsh way to say it is stay in your lane, but to practice within your scope of practice. One thing I would always tell chiropractors who start kind of like blurring the lines, towing the line, it's, I can't emphasize this enough how important it is to have chiropractors that work in evidence-based care, because within that evidence-based care, that scope of practice is helping people in chronic pain, and how unbelievably difficult it is to treat chronic pain, and how the scope that chiropractors have can actually benefit people in chronic pain or just pain in general without needing to turn to pharmaceuticals or surgery or anything along those lines. That is really beneficial. And I would hope that moving forward, that chiropractors are able to work and function, and they kind of already are. Chiropractors work at VA hospitals.
Yeah.
They work in other hospitals. They work just like I did with other physicians. Being able to work side by side and provide all of these different treatments within the scope of practice, abiding by evidence-based guidelines, will only serve to benefit the patients more than anybody. It will limit harm and it will maximize treatment benefit. How we get there, I don't know.
Yeah.
I think we're trying, especially a lot of the physicians and even chiropractors on social media, they're trying hard to streamline that. We have a long way to go, but I would just hope that eventually communication is able to be cleared up. I think social media doesn't do it. Unfortunately,
Yes,
you had mentioned before, there's a lot of negativity, and I hope one day that can stop. But I think that starts with just holding each other both within the profession and maybe cross or like between professions, holding each other accountable for the words we say, the treatments we provide, the information that we spread, I think is really important. But hopefully in the future, we're able to kind of achieve a harmony through that, I think.
I love that. And I do have an actual other second question is if a family does have a child and they are looking for a chiropractor because maybe they want that extra layer of another opinion on maybe how to help with colic or reflux or knowing what they know and knowing what you just said about, maybe there's not a lot of evidence, but maybe they can have some tools, how can they find like the sort of best chiropractor in their area that is an expert in that area and maybe not giving them misinformation around vaccines.
Yeah,
I struggle with that. Yeah.
I wish there was some like database that I could send people to. A lot of ways that people access or even just find a chiropractor is word of mouth, people that they know who have seen them. But I'm sure that also works in medicine too, though.
Yeah.
However, I would say you do maybe to a point might have to shop around a little bit in the sense that like if you go to a chiropractor, they start talking about a few things. You're like, I feel like this is something that I should be talking to my family physician about. Not quite sure why we're talking about that here. Maybe just be hesitant. Now, I think more than anything, when you go to a chiropractor, especially for pediatrics, just somebody who's willing to sit down for an extended period of time. If they're sitting with you for 5 minutes or less, and the first thing they want to do is, scan your child with some weird thermometer device with a bunch of blinking lights, and it has this nice fancy printout or comes up on the computer screen, you're like, wow, okay, be hesitant of those things. Again, I'm pretty sure it was mentioned earlier, medicine would be using those things if they were actually true.
We would be first to be using those things, but they're not true. Right.
Exactly. If you start hearing overgeneralizations of things, more so than anything, if it sounds too good to be true, there's a good chance it is. With that said, if a chiropractor sits down with you for an extended period of time, if they hear all of your problems and they're really just trying to help you navigate those things, and they are willing to openly work with other providers that you're seeing, I think that is a better sign more than anything.
I actually have a go-to in my area, right? Because like I said, I had seen one for myself who isn't comfortable with pediatrics, and she was very adamant, and I appreciate that. She's not going to be like, "Hey, yeah, send me your babies," right? And so then I do have one that is very comfortable. I do not know about the diplomate thing, so I have to ask, but he's great, and he knows his limitations. I know mine, and we live in this symbiotic relationship, like we talked about, right? We know what each other can do. He knows that, hey, if this is something that's needed, I'm going to send this baby back to Dr. Mona, and I really appreciate that. And so my advice is like like we talked about, is that if you feel like it's too good, it probably is, but also bring that information back to your general pediatrician or family medicine doctor. Like if they're going to do a treatment on you, like a specialist would recommend. Anytime I send my patients to a specialist, I always say, "Hey, let me know what they tell you." Like I usually get a referral form, but sometimes I don't. I say, "Hey, can you just give me a call and just leave a message on what they're recommending?"
Mm-hmm.
Same thing if I'm sending to a chiropractor. I want to know what they're saying so that we as a team, because the pediatrician, the family medicine doctor, is the medical home. What I mean by that is we should be the ones to have that relationship with you, to look at everything holistically and say, you know what, this is right or this is not. But we need to know what they're saying to say, yeah, that seems low risk. Why don't you go ahead and do that? I don't see any problem with that. Or actually, that sounds really risky. Like, I don't think I want that person coming near you like to do that, right? And so that is what I'm asking for, that we would have that sort of professionality to say, hey, here's what I'm recommending, the patient and family talking to their pediatrician about that so that it is true holistic care, if that's what we want. And so I really appreciate you coming on to talk about all this because, you know, being able to just hear about your lens from both sides, I think is very rare. And I hope our listeners got that amazing perspective. And I'm sure I'll have you on in like another 5 years once you've gone through medical school training, whether you decide to use OMM or not. Because side note, everybody, just because you go through DO school doesn't mean that every DO is licensed to do OMM after residency. You have to get certifications to keep your OMM skills fresh. So I do not have that certification. Hence, I do not do OMM in my office, but I've always thought about getting that back because I think about how amazing of a tool it was. But it is hours and hours of certification. But as a heads up, you can also find a DO that has OMM certifications if you are looking for something, you know, for physical manipulation on top of medical management. Thank you so much for being here today.
I appreciate it. Thank you, Dr. Mona.
Where can everyone go to stay connected? I know you're very busy, so don't expect a lot of posts
Yes.
from him, okay, guys?
Yeah. So I will say my Instagram has been quiet the last couple weeks. I think it's Rich S _ MS2. It may be OMS2. I can't remember if I changed that.
It is MS2. I looked it up before our talk, and it's funny how I know more than you, but you're a medical student, so I give you a pass.
I will say, I have recently started getting more into TikTok just because it's a little bit more long form content, so more educational. So the exact same username, I think my TikTok one may actually be Rich S _ OMS2.
Perfect.
I think I just got to change the Instagram one. But if people want to stay connected, that's how you find me. If you message me, I message back. I read everything myself. And it is me responding to you. So if anybody ever has any questions at all, please feel free to reach out to me.
Yeah, like I said, I found him when he was active doing content and then he took a long break. So please don't take his long break as him not wanting to do it. Medical school is busy, everybody, but I will find the most recent handle name. Don't worry, I'll do that for you. You know that I understand what's going on. So I don't do this for all my guests, but I do it for my medical students because I know I've been there.
I appreciate that.
But I will look at your handle, add that to our show notes, and everyone tuning in, if you love this conversation, give it a thumbs up sign. Make sure you subscribe to the channel and share this on your social media. Say, hey, everyone, watch this video. So, follow Richard, follow Dr. Mona so that we can continue to hopefully create this world where we all can just give good healthcare to everybody and stay within our boundaries of what we know. So thank you, Richard, for joining me today.
Appreciate it. Thank you.